All right, welcome everyone. Today we are hosting our second webinar on nature and mental health under the IUCN Commission on Ecosystem Management Working Group on Ecosystems and Human Health. We have a great session here today. We are going to be diving into this theme of oceans and exploring the science, the governance, and the implementation aspects. Before we get started, I did want to just give a highlight that 150 people from over 45 countries have registered for this event and from a very diverse set of backgrounds. Before we get started, I am inviting Paula Priest, who is the co-chair of the CEM group, to give an opening remark. Paula, please.
Thank you, Lee. So hi, everyone. As Lee said, I'm Paula Priest. I'm a principal scientist for conservation and health at EcoHealth Alliance and the lead of this IUCN CEM Human Health and Ecosystem Management Thematic group. And for you all that probably don't know, but the IUCN has 7 expert commissions, which are a network of scientists that provides IUCN with policy advice. And the IUCN Human Health Thematic Group lies under the Commission on Ecosystem Management, together with several other CEM groups. And on behalf of our thematic group, I would like to thank all the panelists for being here today. I would also like to thank everyone from the Mental Health Working Group, Liz, Rafael, Jess, Alana, everyone for organizing all those webinars. And I would like to thank you all for being here. And I hope you all enjoyed the webinar.
Thank you so much, Paula. This webinar has risen out of a couple of gaps, and I just want to provide a little bit of context before we get into the rest of the roundtable. The first is that much of the work that's completed to focus on conservation in any aspect, science or governance, has a predominant focus on terrestrial environments. What we want to do today is explore that gap, looking at oceans and coastal environments. The second nice setting for this event is we are currently in the middle of the UN Decade on Oceans, which runs from 2021 to 2030. This is intended to be a decade when we really elevate this space and looking at the human health aspects and specifically how mental health is related is essential to this. We also have a global governance space that's incredibly related here. IUCN is an organization that has a foot in environments all over the world in national and regional offices across a range of topics, and also a seat in global policy spaces, sitting amongst the UN institutions and government delegates in global governance forums. Those forums are taking forward decisions on marine issues, including the CBD will have its 16th Conference of the Parties in October, and there are 2 areas where they're looking to move forward. In general, the conservation of marine and coastal areas, as well as looking at ecologically and biologically significant marine areas, including protected areas. How do we think about that in terms of oceans and mental health? The UNFCCC, the climate governance space, is also increasingly focused on blue carbon. And how are we thinking about that in terms of human and mental health as we make those decisions and whether or not they are sound and comprehensive? So today, as we talk about mental health, we're talking not just about the word mental health, but we're also talking about emotional health, spiritual health, health in terms of development, and overall community well-being. So encourage our discussion to keep that focus and for our audience to know that we're looking quite broadly at this. So with that, I'd like to pass over to our co-moderator, Rafael Monge, who is going to lead us into our roundtable. Rafael.
All right, Liz, thank you. Thank you for setting the stage. And hello, everyone. As Liz said, I'm Rafael Monge, and I'm thrilled to be co-moderating today's webinar on oceans and mental health. It's an honor to welcome you all, and I want to start by recognizing the global audience joining us today, whether you are here live or catching the recording later on the IUCN CEM YouTube channel. Your participation is what makes this event truly special. We are delighted to have more than 150 participants from over 45 countries joining us, including representatives from academic institutions, NGOs, government agencies, and the private sector. This incredible diversity reflects the broad interest and crucial importance of the topics that we're going to discuss. Our webinar is structured as a round table with 3 rounds, each lasting 20 minutes. In each round, we'll dive deep into different aspects of the intersection between oceans and mental health, covering science, law and governance, and implementation. Before we begin, a few housekeeping notes. First, those who indicated in your registration will receive an IUCN CEM participation certificate. Also, for you to know, only our panelists will be able to speak and share screens during the session, but we encourage everyone to interact and submit questions through the Zoom Q&A panel. Liz and I will do our best to incorporate your questions into each round of discussion. Also, this session is being recorded and will be published on the IUCN CEM YouTube channel. And lastly, I'd like to remind everyone that we are part of a global community of open dialogue. We invite you to engage actively and respectfully, considering the diverse perspectives we bring to the table. Now, it's my pleasure to introduce our distinguished panelists. First, we have Laura Fleming, leading scientist in the field of marine environments and human health. She's a physician, epidemiologist, and chair of the Oceans and Human Health at the University of Exeter in the UK. Also, we have Alana Malinde Lancaster. She's an expert in environmental law and ocean governance, head of the Environmental Law, Ocean Governance, and Climate Justice at the University of the West Indies. And she's also a co-investigator at the One Ocean Hub, and she's from Barbados. And finally, we have Jacqueline Evans, an ocean advocate and researcher with extensive experience in protected areas and policy implementation. And she is the director of the Moana Foundation from the Cook Islands. Finally, I would like to acknowledge our organizing team, which includes Liz Willets, our co-moderator today, and she's the lead of the Nature and Mental Health Working Group, and Paula Priest, who is the co-chair of the IUCN Commission on Ecosystem Management. You already met them. We also have Jessica Fisher. She will be providing support with the logistics of this webinar. She is a postdoctoral research fellow in biodiversity and well-being at Durrell Institute of Conservation and Ecology in the University of Kent of the UK. And Elena Valkova, or rapporteur. She is the founder of an NGO in Slovakia called Stromospet, aimed at enhancing health and well-being through nature-based programs, environmental protection, and education in these areas. And me, your co-moderator, I also support the Nature and Mental Health Working Group as network coordinator, and I'm sending my regards from my home in Costa Rica. Liz, back to you to kick off the first round of questions.
Thank you so much, Rafael. So to get started in this space, we do not have a structure. We don't have a structure under oceans. We don't have a structure under health. So let's hear from our experts. Starting with Laura, can you tell us your story? How did you arrive to be working in this ocean space? And can you let us know some of the main challenges you have focused on in your career related to oceans? I will then turn to Alana and Jackie to inquire the same.
Okay. Thank you first to Liz and Rafael and to all the team at IUCN for having this webinar. I think it's a really important and timely topic, and I gather we're going to hear more about how timely it is at the end. So as mentioned, I'm a physician and epidemiologist, academic. I'm from the US, but I've worked on both sides of the Atlantic at the University of Miami and also at the University of Exeter. I've been very involved for now many decades in interdisciplinary research, particularly my area of interest and focus has been around oceans and human health. This is an interdisciplinary, international area of research. Some people call it a meta-discipline, which tries to look at both the benefits as well as the risks of the ocean for human health and well-being, and also at the health of the ocean and how those interact. So I guess the way I would summarize it is, in general, human actions over history and currently have caused major impacts on the health of the ocean, which in turn have come back to haunt and impact human health and well-being, particularly in climate and other environmental change, such as chemical and ocean pollution, but also just in plain anthropogenic exploitation of ocean resources, such as habitat and seafood destruction, marine mining in the future, etc. Yet at the same time, there is new evidence of how the benefits of a healthy ocean are available if we can do it sustainably and equitably for humans, such as seafood, transport, marine drugs, marine biotechnology, and more recently, a lot of evidence around improved physical health and mental well-being when humans are able to access equitably and sustainably healthy oceans. I'm also interested in issues around health and well-being of coastal populations, especially around marine protected areas, and I hope to learn from my colleagues today. Also issues of equity, health, and environmental justice, and how these do or do not interact with current policy. And in terms of challenges, I think a challenge through all the decades that I've worked in this area has been that most in academic circles, funding and resources are focused on the land, not on the ocean, as has been mentioned, even though 70% of the world is covered by ocean, and also not on the so-called global south, even though as an epidemiologist, 88% of the world's population and much of the resources, including the ocean, exists there. And I will say, and this is closer to home and we'll touch on it later, there's been a general lack of medical and public health expertise and interest in oceans and human health, and really in environment and human health. And part of my role has been to try and increase that interest, and I think my colleagues as well. Thank you.
Thanks, Laura. An amazing career. Alana, can you tell us your story? How did you arrive at working in oceans, and what are the challenges you focus on in your career?
Thank you, Liz. Thank you to the IUCN and to my fellow co-panelists. So I've always been fascinated by the ocean and marine environment, and I hail from Georgetown, Guyana, which is on the South American mainland. And we only have one coast, and none of the, now that I live in Barbados in the Caribbean, you think of the beautiful blue waters and so on. But Guyana is between the Amazon and the Orinoco. So while it's very nutrient rich and good for fisheries, it's not the most picturesque. But I've always been fascinated by the ocean, and I began my career in environmental science and geography, and I worked for many years in the Environmental Protection Agency in Guyana within the context of environmental impact assessments, integrated coastal zone management, protected areas, and the multilateral environmental agreements, including many of those which relate to the marine environment, and which we'll discuss. And much of my work became increasingly legal in nature. So I pivoted and I became involved in marine and environmental law, ocean governance, and climate change. So I'm now in the academics, mainly in the academic sphere, but I view myself as I guess an activist scholar. And most of my work is interdisciplinary in nature, because I try to not only marry my two main areas of academic expertise, but also I collaborate with a wider body of professionals and academics within the organization called the One Ocean Hub, which I can say more about. I think with respect to oceans and human health, this has been an increasing interest of mine, because we have worked, one of the key areas of work we're doing is linking environmental rights and human rights. And increasingly, we've seen, for example, the ratification of the right to a healthy environment, and many of the rights will be, many of the areas we will be discussing are increasingly important human rights that that are being underscored globally. I also I'm interested in other area that Laura mentioned that I'm interested in is in climate justice. So the inequities between the global south, global north, and even within populations. So the more vulnerable populations, such as coastal, small scale fishers. And so a lot of the work that I do involves the human rights with respect to the marine environment, which, as Laura said, is hugely under-researched with respect to vulnerable peoples and vulnerable states. Thank you.
Thanks, Alana. Such a wealth of experience. Jackie, please tell us your story.
Hi everyone, kia orana. As we say in the Cook Islands, it's a wonderful honor to be here participating in this webinar today. Thank you for organizing. And I guess my interest in the ocean has started very early. My father was keen on the ocean. He was a keen diver. He loved to go boating and fishing. And my mother is an Indigenous Cook Islander, and I spent, almost all of my adult life, in the Cook Islands. So I developed very early an interest in the marine environment in high school, and I went on to university to study marine science and environmental studies. And it actually raised awareness for me in terms of how much humans impact the ocean environment. When I saw all of the impacts that we have in terms of pollution, in terms of overfishing, in terms of the climate change, I felt very driven to do something about that. So I've been working in this space all of my career in terms of coastal marine protected areas, reviving traditional practices of marine protection, and working on wastewater management for coastal pollution issues, through to working on ocean protected areas. So that's my interest. I just recently graduated from Harvard University with a Master in Public Administration, and I'm here currently at Harvard doing research on the environmental impacts of a proposed mine in the Arctic. Yeah.
Really fascinating. Well, thank you so much for these stories and setting a stage for our audience to hear your experience and your views. So over to you, Raphael.
Yes, Liz, thank you. Thank you for sharing. What about we start with the first round of questions? The first round table is going to be on science. So I'm going to ask the first question, and Laura, if you mind, I would like you to answer it first. I would like you to tell us what is the current state of science on oceans and mental health? Are we seeing a blend of Western science with traditional or indigenous knowledge, or is there still a gap? Where do you see the most significant gaps in our understanding?
Thanks for that question. I think if you look at the scientific literature, the academic literature, peer-reviewed, published, there was a lot of interest about 25 years ago on the so-called green gym. So the idea was that natural environments could help our health and our human health and well-being. And it's much more recent that people, as we've been saying, as my colleagues have been saying, the ocean tends to be ignored, even though it's 70% of the surface of the earth. And only, I would say, like in the last decade, that people have been looking at blue environments. And by the way, it's not just the ocean, it ranges from fountains to canals to ponds, but the ocean obviously is the 10-ton gorilla. There's been a number of different types of studies, so little tiny studies, case reports where people will say, I do cold water swimming and it makes me feel better, to very large countrywide studies using census data. And in general, as a summary, it can be said that people who live closer to the coast, and I have some caveats about all this, but people who live closer to the coast report better general health and better mental and physical well-being. And there are obviously exceptions to that, and it really needs to be looked at in terms of people's access to the coastal environment, particularly healthy coastal environments. That is not equitable. And that includes not only, for example, racism that's banned people from coastal environments, but also for disabled people, for example, not being able to access coastal environments, but also often around the world, many of the poorer populations live next to highly degraded coastal environments. So even though they're able to access them, it may or may not be good for their health and well-being. The kind of mechanisms that they talk about in terms of why are coastal environments better for people, why are blue spaces better for people's health and well-being, range from things like social interactions, increased physical activity. People have even looked at the aerosols to see if those can be good. And by the way, those can be good and bad. Everything has positive risks and benefits. And also just blue visuals. And by the way, this is important, for example, for people who are, due to illness or disability, not able to reach blue environments. Even things like VR, virtual reality of blue environments, have been shown to be positive for people's mental health and well-being. So there's a lot of new research out there. I urge people to go take a look at it. We'll send around some potential links so people can look more at that. And again, I'm talking a lot about the published, peer-reviewed traditional medical and public health literature. I am going to ask my colleagues to respond more around Indigenous health. The only thing I will say is that the Global South has been largely ignored in terms of formal academic studies. I was personally participated. I was lucky enough to participate with colleagues from Indonesia who have published a paper looking at people during the pandemic who live in a marine protected area in Indonesia, and their reported health and well-being, mental health, was much improved by being able to recreationally interact with blue environments. Many of these people also worked in those environments. So it does get, it gets messy from a scientific point of view. The other thing I'll say in terms of gaps, from my point of view, there's a bunch of gaps. There's a whole new area called nature-based solutions, and that has been, it's very big in environmental science areas and in planning. The idea is that you try and work with nature to improve the natural environment, but now increasingly people are saying there are co-benefits for health and well-being if we improve the natural environment. And that can also be towards, for example, trying to mitigate or actually adapt to climate change. So there's a lot of work to be done in that area. There's a lot of work, obviously, to be done in the Global South with vulnerable populations, with populations that have not had access in the past. There's a whole discussion around, can we basically eliminate medications that are used, particularly in industrialized countries, for people's mental health by having people interact with natural environments. I am personally really interested in the whole role of marine protected areas in this space. And again, I'm hoping my colleagues can talk a lot about that. And also, can natural environments, particularly blue environments, prevent illness as well as treat it? And how do we do that sustainably? One of my fears of my research and that of my colleagues is we're encouraging people to love nature to death. So I think there's a whole piece there about how do we interact sustainably, equitably into the future with our natural environments, because unfortunately, humans have not done a good job at that over the years. So not a short explanation, but that's all I have to say.
All right, thank you, Laura. And well, for those online, you can see in the chat some links to some recommended articles that Laura shared with us for you to also have some research. And I'm also curious about your opinions, the other panelists on this question. Jackie, do you see the science on health and mental health in your work? What will you add to this conversation right now?
I haven't sort of been involved in the academic side of the mental health area in respect to mental health and ocean use. I only have my my personal experience, so I I do recall when we had the reintroduction and revival of the traditional practice of banning the use of natural resources in our coastal marine environment in Rarotonga, the Cook Islands. I remember the sense of unity and joy with declaring those protected areas once again, after they hadn't been, in some places, they hadn't been practiced for over 40 years. So to see that, to see the pride and empowerment of Indigenous community leaders, respected Indigenous community leaders, and to see them active in reviving their own traditional practice, I thought that, I do recall that being an excellent mental health outcome for them. But again, I don't have, I didn't do any kind of academic exercise with respect to that, unfortunately. Yeah.
Yeah, thank you, Jackie. Just knowing that perspective is interest for us because you have been very well involved in these issues, and we would like to see how we can engage more on the mental health in the work that somebody like you do. So, Alana, would you like to also add some thoughts here as we close this first round?
Certainly, Raphael. I think one of I'll say a bit about perhaps Indigenous knowledge or the Indigenous aspect. And I think certainly when you look at many Indigenous cultures around the world globally, especially those that are coastal, there's an intimate relationship with their environment. And for many reasons, as alluded to by Jackie before, they have been cut off from many of these practices, and which has led to the loss of the benefits from these practices, as well as the practice of itself, in which we have now identified as a breach of their human rights, especially the fact that it impacts the ability to translate this knowledge from one generation to the other. I guess I will also say that the science with respect to mental health in the ocean permeates many of or should permeate, and maybe this is where we need to think of it through this lens. Many of the critical issues we find ourselves confronted in the Anthropocene, and I'm speaking about the triple planetary crises. So this is climate change, biodiversity loss, as well as pollution. And I think for many reasons, the health aspects are usually more looked at in terms of physical health aspects. And even when they are looked at in the marine environment, we think of them as food and nutrition security. But now I think one of the benefits of us starting this discussion is for us to think, what about the mental health aspect? And it runs through all of these planetary crises. And I will put a report by the Ocean Panel on Climate Change, which is the Intergovernmental Panel on the Oceans, which is a unique mix of global South and global North countries, chaired by the governments of a certain list of countries who have been progressively doing work on various aspects of oceans, including going into communities and so on. And one of them is on health. So I'll try to get the link and put that in the chat. Yes.
Thank you very much. Liz, would you like to continue our second round of questions?
Sure, we've already heard a tremendous amount, so we're going to move to the second round to keep time. And we have a sense of the science, have a sense of the balance of science, have a sense of what the health sector may or may not be doing in this space. And we're going to move to a topic now on specifically looking at governance, which includes policy and law, and can touch on any scale, global, regional, or national. So Alana, I'm going to pivot back to you on this. And to start us off, want to also hear from Laura and Jackie on this. Alana, can you tell us an opportunity as well as a challenge for integrating nature and mental health into oceans governance? So an opportunity you might see in our governance landscapes, as well as the challenges of making that happen.
Yeah, I suppose let me start with the opportunities because that's probably the bright spots. One of the things, let me start by saying, I think one of the positives, if I dare say, that came out of the COVID-19 pandemic, not a lot of them, some of them, but maybe that's how we look at them. But certainly from where my perspective is that the conversation on mental health increased. The region I am from, and I suspect from many other regions, discussions on health is one thing, but mental health is usually not, it's in some instances taboo, and in some instances it's not a discussion that people do not want to have because of the negative connotations. But I think during the COVID-19 pandemic or post-COVID-19 pandemic, this is a discussion we've been having. Now, with respect to governance frameworks, and I think because a lot of emphasis has not been on mental health, and even more so with mental health with respect to the ocean, a lot of the existing governance frameworks we may have may not specifically contemplate this, though I will say, like for example, the Convention on Biodiversity, because it places a premium on indigenous knowledge. There are entry points we can find, in the Convention on Biodiversity. Certainly, one of the hottest topics literally is the climate change discourse. And because of the potential impact, we know that climate is impacting persons' health. And I just saw a report, I think yesterday, about how many persons in Europe died from heat stroke. But certainly if persons are dying from physical impacts, they must be affecting their mental health. And I think we've, at the level of the European Court of Human Rights, this discussion has begun. So early this year, we've had a case brought by some elderly women indicating that, the impacts of climate change disproportionately impacted them because of their age. We have children and youth bringing similar claims. So in terms of governance frameworks that are evolving, we have or nascent, we have the BBNJ agreement, which has not yet come into force, but is on its way there, which has significant entry points, again, where indigenous and local communities can bring their knowledge as well as their concerns to the fore. I think particularly two entry points in terms of global frameworks that are evolving, that now that this awareness that we have can be incorporated, is in the treaty, they currently being negotiated, and also the pandemic treaty, which I think that we need to include these into those frameworks, so then they can then permeate into our global frameworks. As I said, in terms of challenges, the main challenge is, of course, this is not something that has been a lens which we have been looking at globally. And as we begin the conversation, one of the things we need to identify are the gaps and how we can fill those gaps. What are the priorities? I think culturally and societally, one of the main challenges, however, is what I alluded to at the beginning, is that in many respects, mental health is a taboo topic in many cultures and societies. And combined with the ocean, which in some societies also holds many taboos as well as, in some circumstances, for example, in the Caribbean, there's a kind of a love-hate relationship. I don't want to say hate, but there are a lot of taboos and laws as it relates to the ocean. So I think because of this, it may not or may not be viewed as a priority. But as I said, increasingly, and Laura alluded to it, we see that there is a clear nexus between you know, mental health and the ocean. Of course, more needs to be done, and clearly we need to get to the state or as developed knowledge as we have with respect to our physical health and the ocean and other spaces needs to be developed and supported in terms of policy and governance frameworks. So the challenge is getting it into prioritizing it.
Can I jump in here for just a moment? Because in our preparation, I remember you said something really interesting about going from global scale down to regional, looking at the Caribbean and some of the fisheries frameworks and other national spaces. Could you just briefly, really briefly, in less than a minute, comment on kind of that national scale that you've also paid so much attention to, and some of the other frameworks at that scale?
Yes, so one of the things I had alluded to is that while globally we may not have a lot of these frameworks, so a lot of my experience has been in the Caribbean region, and we have a regional seas program called the Cartagena Convention and its protocols, which while may not have been while they were being drafted, and indeed these are living instruments, did not contemplate mental health in the oceans, for example, can support. I also point to the fact that we have the Escazú Agreement, which has recently come into force, and which many Latin American and Caribbean states are ratifying, which for the first time conclusively links human rights and environmental rights. So this is another exciting entry point that is also supported by the Protocol of San Salvador, which is the protocol on social and economic rights to the Inter-American Convention. And we in the Latin American region and Caribbean region are anxiously awaiting advisory opinion on the climate change and human rights emergency. And we have seen that the Inter-American Court has already in a previous advisory opinion conclusively linked the importance of human rights, or the right to a healthy environment in the Cartagena Convention area. So that's the marine space between that is shared in the Americas and the Caribbean. They've linked it to the right to a healthy environment. So this is a important nexus, not only with the regional seas program, but also the human rights and environmental and human rights treaties in the region that can then perhaps be scaled up, because we have a similar treaty to the Escazú in the European area called the Aarhus Convention.
Thank you so much, Alana. And your expertise ranges such an impressive gamut. I want to jump over to the other side of the world with this question, over to Jackie. And in the Pacific, could you comment on, the governance space that you've worked on most closely, and how there may be opportunities to bring in the social aspects of human and mental health, as well as the challenges that you either have faced or foresee facing in that governance in terms of policy or law?
Thank you. Yes, Alana presented a lot of really important frameworks that need to be considered in this space. I could just add another one, which is the development of the seabed mining exploitation regulations and the International Seabed Authority, which is happening right now. It's a very contested area at the moment, and I know that fortunately there is a intersessional working group at the moment on cultural heritage, underwater cultural heritage, which is a really important part of ensuring that Indigenous issues are met, and any other sort of cultural heritage concerns are met within these new regulations that are being drafted. In terms of other opportunities, I know that the 30 by 30 protected areas by 2030, that's a commitment that's being worked on all around the world, is a great opportunity for incorporating mental health considerations in the governance frameworks of those new marine protected areas that are being established and others that are being expanded. And I think that this is excellent work, and we perhaps need to have some more consideration of data collection for the mental health impacts of these protected areas, and also basically the overall impact of having these large protected areas established. I think that that we do need to plan beyond 30 by 30. We need to think about where resourcing needs to go next, because there's a lot of interest in establishing protected areas, but it's really important to ensure that these protected areas are successful going forward. This is where a lot of our biodiversity loss is happening, is in the failed implementation of protected areas and other frameworks and tools. So I think it's really important to be thinking about how those protected areas that are being established are going to be resourced in the long term. And in particular, I think that it's important to incorporate the private sector more heavily, and keep new private sector and political leaders informed of successful protected areas, where success has been achieved, and how those protected areas have supported the mental health of the people in those communities, which will have flow-on economic benefits. So I think that kind of data collection would be really, really useful, so that we can think about what happens after protected areas have been established.
Thanks so much, Jackie. And just really quickly, we have some ears in the audience here who are not familiar with conservation terminology. And so protected areas or marine protected areas is probably a new term. Could you maybe simply describe, when you talk about a marine protected area, what does that mean?
So a marine protected area is an area that is defined in space to protect and restore the biodiversity, the plants and animals that live within that space. They can be used if they're well located and if they're well sized. You can actually make marine reserves where you don't allow any kind of fishing or other activities within those marine reserves, and they can actually have a spillover effect and actually increase the fishing catch for local fishers.
Thanks so much. And then over to you, Laura. You know, you've been in this science space, you've been in the health space, you've led some of the WHO groups on this. How are you, do these governance spaces even touch the same world that you've been in? And if so, could you give us a sense of what's looking promising?
I would say one of the problems I've seen with sort of ocean governance in general is that health people are not at the table. And I don't think that's based on exclusion. I just think that at the national and international level, health and environmental people don't talk to each other, as a generalization. And I think that's a huge loss on both sides. Health people also are not necessarily trained to think about the environment. They don't think of it as their purview until fairly recently, when the pandemic and climate change is putting it on their agenda, as has been mentioned by my colleagues. So I think it is important going forward that the health aspects also be advertised in these governance structures that have been mentioned by Alana and Jackie, and also researched. I know that sounds like every academic always asks for more research, but I am fascinated by the idea of the fact that these marine protected areas, how they impact on the health and well-being of the human populations that live in and around them. Because I would argue these people are often on the cliff face of trying to live sustainably, equitably, especially if they're involved in the assemblage of these marine protected areas. And that going forward, we could learn a lot from them on how we, as around the world, could live more sustainably, equitably, and healthily in the rest of the world. So for me, the real issue here is we need to get health involved. And another aspect I will also raise is that the health sector is in every single country, every single community, and it can be writ large and small. And it has a huge impact actually on the healthy environment, including the ocean. So for example, in the UK NHS, 80% of the things used in the NHS are shipped. That's international shipping, but no one thinks of that as an impact. So if we can get the healthcare sector more involved in these discussions around ocean governance, I think it will be to everyone's benefit.
Thanks, Laura. A great insight. Raphael, to you.
Yes, thank you. I need to close this round, but before that, I would like to ask you to just make a very short comment about what could be a one next step in order to address these challenges, in your opinions. So just be brief because we have to move to the next round. But Alana, would you like to start?
Sorry, my mic stuck. Yeah, certainly, Rafa, I think one of the things I'd like to pick up is a point mentioned by Laura in the terms of we're not speaking to each other in terms, and by we I mean different disciplines. And I think again another positive coming out of COVID-19, I suppose. But increasingly we need to, because just indeed it's not only a health thing. Generally, lawyers tend not to speak with other disciplines also, and many of the, as we've seen from our discussion, these issues are cross-cutting, and sustainable solutions will need to be interdisciplinary and consider the bigger picture. So for us to have meaningful solutions, and not only meaningful solutions which promote equity, justice, and ultimately the quality of life for the populations across the world in general.
Thank you. Jackie, what would be your suggested next step? Jackie, yeah, thank you.
Hi. Yeah, I guess I mentioned before about the need to collect data on the impacts of establishing large ocean protected areas on mental health, and also the benefits of ocean protection. So I think that would be really useful to provide information for leaders in the political and well, in all spaces really, but in order to demonstrate the benefits to mental health of healthy ocean and marine areas.
Thank you. Laura, what would be your take on this discussion?
Well, I just wanted to expand on what my two colleagues have said. I think that monitoring, where you're monitoring not only the health of the ocean, which is being done, right? There's the World Ocean Assessment and there's huge amounts of monitoring going on of the ocean. And there's also huge amounts of monitoring going on in humans, and they are not linked. And I agree completely with Jackie that you've got to link those, or you're not going to see the consequences. Also, as we do interventions like marine protected areas, how do we know if they're good or bad if we don't follow up those data? And then the last thing is we need to make those data accessible and transparent at multiple levels so that communities, for example, in the Cook Islands, can really use those data. And they can be used also in a legal sense, as I'm sure Alana would say as well. in terms of evidence of harm or of benefit, or both.
All right, thank you. Thank you for your contributions. Now we need to move forward to our third and final round of questions. This is on the implementation side. I don't remember if I told you before, but this is a 1 hour and 15 minutes webinar. So we're going to be ending 15 minutes past the hour. So let's get into it. And this is a little bit related to the discussion we were having before. Our first question, and Jackie, I would like to ask you to answer it first, is how can marine protected areas serve as tools for enhancing mental health? Additionally, how do these protected areas influence human access to ocean environments, and how do we make sure access is equitable?
Thank you, Raphael, for that question. To achieve equitable access, I think we need to ensure there is genuine consultation with respect to the use of ocean environments. I think that any policy change relating to the ocean that comes about without the people that it affects, having a deep understanding of the purpose and implications of the policy change, and without their full support of the policy change, will have a negative impact on the mental health of the people. They will be impacted by not having a sense of agency. They will be impacted by feeling inconsequential and apathetic. We need a metric for ensuring that public consultation is genuine, because often governments consult, they consult the public, and organizations consult the public so that they can tick the box, the public is being consulted. But I've been seeing increasingly dissatisfaction in the public space about not being adequately consulted, not having their concerns heard or received or addressed properly. And this is creating an enormous negative impact on people's mental health.
Thank you, Jackie. I would also like to acknowledge that people are asking questions in the Q&A, and our panelists are answering them live. So don't hesitate to ask your questions there too. Alana, I would like to ask your take on this conversation that we're having right now on implementation.
I'm muted, yes. I think that implementation is often or meaningful implementation is often a critical missing link in many areas, of environmental policy. And looking from a legal point of view, and I can give examples like fisheries, for example, is perhaps a critical example that straddles both, that can be used to illustrate health, protected areas, which Jackie's speaking about, as well as equity. So historically, many states sign on to the Treaty by Treaty, which we all know has its benefits and so on, but often in implementation, a critical aspect that is missing is consultation and involvement of those many of the stakeholders, or the critical stakeholders who these policies are aiming to improve or secure their rights. So, we want to do Treaty by Treaty because we want to increase our fisheries, reduce overfishing, conserve blue and teal carbon, and as well as our oceans, which we know are critical for climate change and biodiversity. But in many instances, what can also happen is cases of exclusion by key members of the population, fisher folk, even persons utilizing or accessing the ocean, which in turn then corresponds not only affects their social and economic rights, but their health. And sadly, many of our laws support these exclusion and inequitable practices. because they're generally top down. So speaking from the Caribbean's point of view, and I suspect in many post-colonial societies, laws were actively meant to exclude and be extractivist. And post-independence, most of our laws have not changed in the approach, even by post-colonial governments. And we have cases. So I know of a case study which I did in an attempt to conserve the pristine blue waters, because they're cherished by tourists. Essentially, the entire fishing grounds of a community was included in a no-take area. So you've taken the ability of that community to fish, and which has impacts on both their physical and mental health. And because this was done in a very top down manner. So I think implementation or effective and equitable implementation is perhaps one of the biggest elephants in the room. And simply because we need to have meaningful participation and consideration of the rights of all those who stand or who are stakeholders in the ocean.
Thank you, Alana. Laura, could you please give us your take on this discussion and implementation?
Yeah, I think, and I'm going to reflect as somebody who works in public health, that there is now a movement in public health to involve communities more. And I think part of that comes from a realization that if you don't involve the community, you're not going to be solving the issue that they're interested in. And also, if people don't have buy-in, it will not be sustainable, in the sense of, once the researchers or whoever walk away, the local community is not involved. So why should they continue whatever action has been done? So I think for a lot of practical reasons, at least in the public health research field, people are starting to do that. For me, the interesting part is also that some funders are now funding the communities, the NGOs, to run the research. And I think that's a really interesting way to do it. I think it doesn't guarantee, but it is much more likely then that the questions being asked and the interventions being proposed are more aligned with what the local community wants, again, making it more sustainable, they're more invested, et cetera. I think going back to something that Jackie and Alana alluded to, I also think it's really important that the local communities have the tools to do that. And it's not just data, but access, for example, to good internet, access to software, access to expertise, and also tools to measure themselves. As an example, and I'll just use an example, there are a lot of them out there. I was involved in a study called Blue Health. And one of the things we did was we created tools that communities could use to measure how the health of their environment, and if they were going to do something, an intervention in that environment. And these were just little interventions, like cleaning up a beach, how that would affect their health by measuring it before and after in their community. So again, it's not just for citizen science, it's also that local communities take control of this. But in order to do that, they need resources, expertise, collaboration with people who do have those resources. And they need to, I think, to be in charge ultimately. Okay, one other thing, education. I don't know if you're going to ask about that, but there's a whole piece on education here. I mean, the data shows that if you introduce children early in their lives in a positive way to the natural environment, they are much more likely to be pro-environmental in their behavior. And to the extent that behavior change is what we're also talking about, human behavior change, writ small and large, that's something we really need to work on. But I would also argue the healthcare people need to be educated as well.
Thanks so much, Laura. And actually, the great segue into our final question, which is on the education part of implementation. And just like we are talking about, the science is terrestrial focused, the governance structures are terrestrial focused. In terms of our education and that component of implementation, do we have anything similar in the ocean space in terms of stewardship, in terms of protecting oceans and building that into programming that's good for child development, or even in the health space. And Laura, you said there's a gap there, but I'd like to pose this question to the group. Do we have similar programming? Are there opportunities to create similar education frameworks and programs on oceans that are good for our health, well-being, and mental health? Let me go first to Jackie.
Hi, thanks. That's a great question. I really want to just share what I've done just in the course of my work, which is seeking out educational materials. I found that NOAA has a really good stack of resources that can be used for educational purposes. I'm talking more about materials, not so much about frameworks and curricula. But just to point out that there are a lot of good materials in the NOAA website. That's the National Ocean and Atmospheric Administration of the US. I don't recall seeing a lot about mental health and oceans in those resources. It might be just because I wasn't looking out for them. And same with Indigenous people's contributions to those resources. Although I know that NOAA requests stories from Indigenous people during their expeditions throughout the oceans, requiring people to contribute to a blog, a web blog, so that they can share their stories. So that is a good initiative. I'll just end there because I'm really only talking about resources. So I'll leave it for anyone else who has anything else to contribute.
Alana, over to you. Any ideas on potential programming or maybe gaps? How does this in the Caribbean?
I think one of the areas I want to speak to is the gaps, because I think this often with respect to environmental and these issues, ocean issues, we look at the law, the policy, the science, and I think in many respects, we put most of our emphasis in that aspect, but not in as Laura said, a lot of the success in these areas will require attitudinal change. And we need to do this at the same level. So while we may have missing policy or science and so on, while we're working on that, we also need education and awareness, and specifically targeted at our youth. I think that's the most sustainable strategy. So ocean and climate literacy and so on, which is missing from most of the structured curriculum. As someone who I used to teach in both the secondary and now I teach in the tertiary area. I guess in the tertiary area it's there because if you're doing a degree in climate science or whatever, you will get that. But in our secondary and primary schools, it is critical that this be incorporated into the curricula, formally as well as informally, maybe through youth clubs and so on. And this is something that I've been flagging for many years, and hopefully one day we'll get traction, because I find we have a more interested youth, but and they become more interested when they find out, but until they're engaged in many of these issues that confront us today, they're very apathetic because they're conflicting messages. And more than ever, I think we have a diversity of platforms in which we can share experiences. So one of the things that we started working on in the One Ocean Hub is something called One Ocean Explorers, which we would get groups of primary school students from different parts of the world to address try to solve a problem related to key issues, climate change, plastics, and so on. And then we try The intent was to get them together virtually to share their experience. So there'll also be a cross-fertilization of experiences between persons from the Pacific, Africa, Scotland in this case, and the Caribbean. However, for reasons, again, for some reason, this is not something that's attractive to funders. I don't know why. Maybe it's not as immediate impact, but it's more of a cumulative impact, I think, and a necessary impact. So this is something hopefully we will get more traction on to be able to explore that from it. Because I do think that you'll be amazed at some of the insights and ingenuity of our younger generation. And a lot of this, we speak about intergenerational equity and protecting the rights of the youth and children. This is critical, and perhaps one of the key things we can do to write, we meaning those of us who are adults and who have created a lot of these issues. Maybe this is one of the gifts that we can give them as we seek to progressively address many of these planetary crises.
Thank you so much, Alana. We have 5 minutes left. Laura, I'd love to hear just a kind of a short bit on any insights you have to this education space, which is so critical, and then we'll address some of the questions in the Q&A.
Very briefly, there's a huge amount of work that's been done around ocean literacy, writ large, small. Some of it's controversial, but you have to take a look at the web. The UN now is really finally including youth. They've discovered youth so that now most of their panels have to have a youth representative. They have a youth office. There is the potential for people who are youth to get involved at that level, and I urge them to do that. I have a book on oceans and human health. It's free through Science Direct. And let's see if there's anything else I wanted to say. I think I also mentioned that I also think that there is importance not only in what my colleagues have said in terms of building it into existing curriculum, and it's not just oceans, it's environment and human health. It's really understanding that we are all on the same planet, and if we destroy our planet, we are screwing up our own sandbox. So I think there's a lot of work that can be done, and there is a lot of good work out there to draw from.
Well, thank you so much. Unfortunately, we are just coming out on time. Alana, would you like to put your comment in the chat?
Oh, okay.
We have just a few minutes, and we've run to the problem. We run out of time for Q&A, and so I just want to acknowledge a theme that's coming through. We have a lot of listeners from the African region. We do not have an expert from Africa on our panel here. And I just wanted to see if there are any particular insights that might be coming to mind from our experts from different regions on their knowledge of what might be happening in the African region, or the gaps or the needs to build into different agreements, et cetera. Just a quick 30 seconds is what we have time for. So, Laura, you're nodding. Can I ping you first on this?
I mean, I would work with people who are on the cliff face, and Jacqueline Uku, I'll put her stuff there, as somebody I've worked with who's incredibly knowledgeable on many levels, and she's based in Kenya.
Over to you, Jackie.
Sorry, the question was, can you just repeat the question? I was just answering another one.
Any quick insights on African region on this topic? Because we're getting a lot of questions and we have a number of listeners in our pool on this topic. Gaps, programs that you know about, synergies with your region?
Not in the African region, but I was just writing a bit about, just to follow up on education, experience that we have in the Cook Islands, where we had, it was really successful in encouraging positive attitudes towards the ocean environment, and it's called Lagoon Day, which I'll share in the chat. But I don't really have anything to present about the Africa. Yeah, thanks.
So We certainly have it on us, and the time we have to do this, a responsibility to respond to this region. But Alana, 30 seconds. Do you have 30 seconds on anything you might know about the African region on oceans and mental health?
I think, I guess my best reference would be the work already done by, we have done some work in the One Ocean Hub in Africa, but specifically in South Africa, Namibia, and there's been a bit of work done in Ghana in terms of oceans and coastal mangrove communities. So I have shared the link for the hub. I'll put it in the chat again. And feel free to reach out and we can continue the conversation. Yeah.
So much for that access. Raphael, would you like a closing word to our workshop?
Yes, thank you. I would just like to say that in Costa Rica, we live by the phrase pura vida, which captures the deep connection we have with nature. Our oceans, rivers, and forests are not just landscapes, they are lifelines sustaining both our environment and our mental well-being. Today's conversation has shown how important it is to share our diverse perspectives to protect natural spaces for ourselves and future generations. Thank you all for participating. I hope today's insights encourage you to incorporate these perspectives into your work and into your life. Pura vida.
Thank you so much. I will close the session now with a huge thank you to Laura, Alana, and Jackie, and my fellow colleagues here at the CEM. I would just flag, we do have a very important opportunity coming up on the CBD in COP16 in October, which is the draft Global Action Plan on Biodiversity and Health, which I am putting in the chat here. Have a look, have a read. This is a chance to build in some of these aspects of oceans and mental health, as well as many other aspects of health. Thank you so much for your interest. There will be a recording and we will send follow-up to the registrants.
Thank you.
Thank you very much. It was a
Thank you.
pleasure.